Welcome to Lee's Lessons. Today we're going to talk about the word dizziness. So often we say a person with POTS is dizzy, but dizziness is actually a really vague word and it can mean many things. All right, so we need to talk to the doctors about our dizziness, but we really need to give them more specific descriptions when we do talk about our dizziness because it can help them figure out where is it coming from. We have our lightheadedness, our near fainting, or our fainting type of dizziness. So when we feel like we're going to faint, but we don't faint, it's called presyncope. When we do faint, it's called syncope. Some common symptoms with this type of dizziness can include, well, we know that blurred vision, right? The dark spots then can happen, the tunnel vision. We can be nauseous, we can have sweating, just this internal heat feeling, confusion, heaviness in our legs and arms. We can even get tingling into our legs and arms. A floating feeling can be a good description. So really when we get this lightheadedness, the syncope and presyncope, it has a lot of different causes, and the doctor wants to look at dehydration, blood pressure drops, autonomic nervous system issues such as POTS. There can be big emotional trauma or stress. You can have uncontrolled diabetes, low blood sugars, medications, carotid artery issues, and of course, cardiac issues. Basically, if our brain is not getting enough blood, oxygen, and glucose, we're going to be lightheaded. It's important that we go through our medications with our doctor, and we can even utilize a pharmacist to make sure the medications that we're on are not causing our dizziness. Okay, another common description for dizziness can be unsteadiness. I see this a lot as a physical therapist. They don't say they're lightheaded, but they just say they don't feel steady when they're on their feet. There's many causes of this, and we look at things such as weakness in the trunk, maybe the legs. They could have some neuropathy in their lower body, orthopedic issues. You could have inner ear or brain dysfunctions. Maybe proprioceptively, these signals from our joints and our tendons and our muscles aren't getting to the brain properly. So we're not getting a good communication with our brain about where our body is in space. It's important that you talk to your doctor when you're having these type of issues so they can discover what is causing it. And often a physical therapy, is very important so we can help improve some of these dysfunctions. All right, another type of dizziness. I am a vestibular therapist, vestibular meaning inner ear, and there's a sensation called vertigo. And that is a feeling where you or your environment is actually, well, you feel like you're moving, but you're not moving. It's a very uncomfortable feeling. You can get headaches and nausea, you can vomit, and there's different causes. The inner ear, of course, is one. There could be a common issue with the cervical spine. We often forget about that, but it's important to look at. Even the brain. So if we're looking at ear and brain, probably a neurologist or an ear, nose, and throat doctor would be best to look at those dysfunctions. You really want to call them and make sure they specialize in these areas. If, and sometimes it's a rule out type of diagnosis, if it is coming from your cervical spine, typically our upper part of our neck, you might want to speak with a spine specialist or a neurologist. Again, ask if they treat, if they diagnose causes of vertigo, because some of the physicians do not do that. One of the most common causes of vertigo is a big word called benign paroxysmal positional vertigo, otherwise known as BPPV. It's where these calcium crystals, they migrate into a certain part of your inner ear, and they really shouldn't be there. And unfortunately, when we move our head in certain positions, it causes this terrible vertigo and nausea and vomiting feeling. A doctor or a skilled therapist who is trained in this area can actually help you take care of this condition within a couple of visits. All right, we'll talk more about that next week, and I hope everyone is having a great day. I hope you're healthy, and I'll see you next time.